Good evening. My name is Karen Freeman Wilson, and I am the President and Chief Executive Officer of the Chicago Urban League. It gives me great pleasure to welcome you on behalf of the League and the community to a community conversation about vaccination. We have gathered tonight a group of esteemed panelists, experts, people who can answer your questions, who can allay your concerns, who can address your concerns and do it with candor and great transparency. And before I turn it over to those experts, I want to tell you I'll give you a personal testimony. Over a year ago, in March, I was one of the first individuals in this area stricken with COVID. In fact, I came down with it on March 13th. And I remember going to the hospital and the doctors didn't really know what to do. In fact, the second time I went to the emergency room, a nurse asked me, "You don't want to be admitted, do you?" And when that question was posed to me in that manner, I said, "Absolutely not. I'll go home to die." Wow. And quite frankly, I thought, as I looked at the numbers add up on CNN, and some of you remember the early days where they put the number of people who had tested positive or who had been diagnosed and the people who had died. And I wasn't sure for at least a week where I would end up on that screen. Well, the good news is over a year later, I'm here. I'm very blessed that I have not had a lot of long-term impact from it. But I can tell you that when I see my friend's Twitter handle that says, "Get a vaccination," or "Get a toe tag," that is real. And so we are just here providing the information, but also compelling you to consider yourselves, your families, and to get the vaccination, because in fact, it does save lives. So with that, I'm going to thank our panelists and turn it over to Calmetta Coleman, our Senior Vice President of External Affairs and Programming, someone who has been working on our vaccination awareness work, and with our thanks to her and her team for developing this seminar for tonight. Thank you.
Thank you so much, Karen. Hello, everyone. My name is Calmetta Coleman. I'm Executive Vice President of External Affairs and Programs for the Chicago Urban League. I want to thank all of you for joining us either live on the Zoom webinar as well as on Facebook. I wanted to just start by doing a couple of housekeeping things. So if you have questions throughout the evening, feel free to drop them in our Q&A within Zoom or in the chat function. We'll be monitoring that. If you are joining us on Facebook Live, please feel free to drop your questions into the comments on Facebook Live, and we'll be watching that and get to you there as well. So before I introduce our moderator for this evening, I wanted to actually get a sense of who's with us and what people are thinking. I know some folks are still coming in, but I would like to start by launching a poll. Maybe it actually looks like people are already viewing the poll. And so we may have some results. Can you guys see it? If you're the people who are on, panelists, I think maybe you can. So it looks like most people who are on have actually maybe started the poll. Because I didn't realize it was running, I'm going to start it again so that everybody has a chance to participate. Can you see it now, panelists? Because I can see. Okay. And so even if you took it already, I'll just ask you if you don't mind just repeating your responses quickly. I'll give us like a minute or two for people to complete it if you can see it, just so we get a sense of where we are and kind of who we are this evening. For the people who are joining live on Facebook, you can't see the poll, so I'm actually going to just read the questions. The first is, have you gotten the vaccine for COVID-19? And it's just a yes or no question. The second one is, have you gotten or do you plan to get a flu shot this year? Yes, I already got it. Yes, I plan to get it, or no. And then the final question is, what concerns do you currently have about getting either a flu or COVID-19 vaccine? And the options are, are you concerned that the vaccine might not keep you from getting sick, that the vaccine might have unknown long-term side effects, that the vaccine might actually make you sick, or as I've heard some people say, I simply don't like shots. I believe that the government is using the vaccine to track us or specifically harm Black people. And then finally, I do not have any major concerns about either vaccine. The poll has been running for about a minute and a half, so I'm going to assume that everyone who wanted to participate has done so. And so we're now sharing the results, and if you could see them. So 100% of the folks who took the poll who are on with us have gotten the vaccine. So that's always good news, especially after hearing Karen's story. For the second question, have you gotten or do you plan to get a flu shot this year? 86% of people said they plan to get it. It doesn't sound like any of us have gotten it yet. And then we've got 14% of folks saying that no, they haven't gotten it and don't plan to get it. In terms of number 3, what concerns do you have about getting either vaccine? 14% of folks said they were concerned that the vaccine might have unknown long-term side effects. And then we had 86% of people, so really everybody else, saying that they don't have major concerns. And that makes sense, since it sounds like most folks who are on with us actually have already gotten the vaccine. So with that, I'm actually going to start to turn this over to our panel so we can get right into our discussion. I want to start by introducing our esteemed moderator, Dr. Jeffrey Sterling. Dr. Sterling is a leader in community-based healthcare, organizational operations, and efficiency. He is the founder and CEO of SIMCO, which is America's first managed preventative care organization. He is also president and CEO of Sterling Initiatives, an international healthcare consulting and implementation firm that provides organizations with clinical, operational, and financial best practices. Dr. Sterling is also author of the popular healthcare blog, Straight No Chaser, and the books Behind the Curtain, A Peek at Life from Within the ER. There are 72 hours in a day, using efficiency to better enjoy every part of your life, and Voices and Visions, the evolution of the Black experience at Northwestern University. He is also the inaugural Surgeon General of Alpha Phi Alpha Fraternity Incorporated. So without further ado, I will turn it over to Dr. Sterling. Thank you so much for joining us.
It's a pleasure to be with you, and thank you so much to the Urban League for continuing to provide forums like this to inform and empower members of the community. I truly am honored to be in the midst of icons, legends, and leaders this evening, and I don't say that lightly. Before I introduce, however, tonight's esteemed panelists, allow me to provide you some perspective on where we are with the pandemic. This is a little bit of a did you know? Let's pull back the curtain. Did you know that there have been 43.2 million cases of COVID-19 in the United States now? That represents about 1 out of every 5 cases worldwide. There have been 692,000 deaths in the United States, which is about 1 out of every 7 deaths in the entire world. 692,000 deaths. Who would have thunk it at the beginning of this? And how would you have responded if we told you that's where this was headed? Now, regarding the vaccine, did you know that there have been over 380 million vaccine doses administered just here in the United States? There have been almost 100 million doses of the Pfizer vaccine, over 66 million doses of the Moderna vaccine, and over 14 million doses of the Johnson & Johnson vaccine. It's quite a bit. One other quick fact that I want you to know, I just want to do this. We'll talk with the panelists about this as well. Yes, we talk about the variants, and we'll get into that a little bit, but it's the Delta variant now that is the dominant circulating SARS-CoV-2 variant, representing about 99% of recently sequenced lineages. So this virus variant is actually twice as contagious as previous variants, and we're going to be talking about why that's important. What we're going to be doing with our panelists really is weaving a story. We want you to understand the story. We're going to take you from a beginning, and we're going to go through this so that you get an understanding of the entirety of the narrative and not just have some questions and answers given to you. And now to our panel. Dr. Lamenta Sweetie Conway is the Deputy Chief of Medicine for the Illinois Departments of Corrections, overseeing medical care and services for approximately 50,000 incarcerated persons. She is also the founder of I Am Able, a growing and highly impactful nonprofit foundation, which is a pipeline mentoring program that helps inner city Chicago area youth navigate careers in medicine. I Am Able now includes over 100 physician mentors with collaborations with major academic centers and community organizations locally and nationally. Dr. Conway is trained in both internal medicine and pediatrics from Rush Medical College of Rush University Medical Center and has a master's in public health from the University of Illinois in Chicago. Welcome, Dr. Conway. Dr. Shawn Smith is from Detroit, having received her MD from Boston University School of Medicine and having completed her pediatric residency training here at the University of Chicago, Comer Children's Hospital. She is a neonatal ICU hospitalist at Lurie's Children's Hospital. Pretty sure she's the only person here tonight that can say that. And Prentice Women's Hospital in Chicago, Illinois. She is also an assistant professor of pediatrics at the Northwestern, Go Cats, Feinberg School of Medicine. In that capacity, she is the site lead for the Prentice Neonatal Intensive Care Unit Hospitalist and a member of the Northwestern Medicine Pediatrics Operations Committee, the Lurie Children's Pediatric Residency Committee, and the Faculty Advisory Board. You're quite busy. She's the Director of Diversity, Equity, and Learning. Her work is so robust and so encompassing that she's recently been awarded 2 grants, one from the Northwestern University Office of Diversity and Inclusion, and one from Lurie Pediatrics Advocacy to bring awareness to implicit bias in medicine. She is a 2021 Leadership Greater Chicago Fellow and resides in Chicago with her husband and 2 sons. Welcome, 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 Dr. Smith. It's a pleasure to be with you. And last but certainly not least, Dr. Carol Adams, who is the former Secretary of the State of Illinois Department of Human Services, the largest agency in Illinois state government with over 14,000 employees and a budget of over $6 billion. As if that wasn't enough, she's also the past president and CEO of the DuSable Museum of African American History, the oldest and longest running museum of African American history in the United States. She's had so many other, my God, she's basically run the world. She's been the Director of Resident Services and Programs for the Chicago Housing Authority. She's been Director of Northeastern Illinois Center for Inner City Studies. She's been Director of African American Studies at Loyola University. In fact, she has literally raised over $400 million for a variety of public and private agencies and institutions. She's a thought leader frequently asked to serve as an advisor around the world on public policy and civic engagement by legislators, corporate leaders, governmental entities. And on a personal note, we're incredibly honored to have her join Simcoe as our Chief Community Engagement Officer. Welcome, Dr. Adams.
Thank you.
Wow. I just want to start past this prologue, as we say, and I'm actually not going to start by talking about COVID. I'm going to start by talking about the Spanish flu of 1918. And maybe the physicians in the group will understand exactly where I'm going with this. So I actually want to start by asking you a question off the beaten path, and I think it's a good way to start our story. So would you, one of you please, or both of you, let's talk about why this past flu season was actually the mildest in memory, because the pandemic back in 1918, actually, we literally just crossed the threshold of how many deaths occurred from that pandemic just now with COVID-19. But as these things go, we have continued to see tens of thousands of deaths every year for the last 100 years from influenza. So let's talk about what happened over this past flu season that made it the mildest in memory.
I'd like to take a stab at this one.
you know, it's really interesting when you actually have a very confined space that you can actually take a look at. And the prisons is a place where you can do that. And I can tell you that over the entire year, we haven't had a single reported case of influenza, which I think is absolutely amazing. I actually had that as my vision to look at. And of course, I'm in the community and I'm looking at other folks, and I don't hear anybody talking about influenza. People are going and they're being double tested, you know, because they're testing COVID negative sometimes, and they'll swab them for influenza and they're testing influenza negative as well. And I think one of the reasons, or probably the hugest reason, why we haven't seen much influenza is because of our mitigation tactics, including universal masking, and it works. And despite the propaganda that we hear, as I said, I can point to the prisons as a population that's very defined and confined, and actually show you data and stats that we just have not had influenza, even though COVID has raged in some parts, you know, and early in the epidemic or the pandemic.
Anything to add, Dr. Smith?
I would agree. We were all hunkered down at this time last year with no vaccine. We all had masks. We weren't in school, most of us. Many people were at home working if you were able to. So we were not out and about. We weren't traveling. We weren't seeing family. So we didn't even have the regular cold. So we were a little bit protected and insulated. And so we didn't see the numbers of influenza that we usually do.
And we engaged in extra things to keep us clean and keep down bacteria, more sanitation. All of those things also played a role.
So, you know, lesson number one for the audience, masks actually work. And there's a reason why the allergy season is another thing that masks protect you from. So these are things that are important for you to realize. I actually tell people all the time that there are tools that we've used at our disposal. You wear masks to avoid contracting the disease. You avoid, and social distancing for those same reasons, to avoid spreading it to others. And we'll talk about why you take the COVID-19 vaccine to prevent dying from the disease. And that's something, by the way, I'm an emergency physician. I've told people for years who have always complained about, well, I took the flu shot and I still got the flu. I would always tell people then, and it's applicable now. You never took the flu shot to avoid getting the flu. You took the flu shot to stop from dying from the flu. And we've very much seen with the mitigation measures that have been in play that we've been able to do that rather effectively. So evolving and following up on that same consideration, there are actually people who can't be vaccinated. There are actually some people that are allergic to the contents, even though the contents are quite mild in this example. And there are people that really have legitimate religious considerations that, for whatever reasons, preclude that. So let's actually, before we talk about treatment and prevention along the lines of vaccinations, let's actually just talk about what are the best means to protect people that at this point have chosen not to get vaccinated or actually can't get vaccinated.
Dr. Sterling, I think one of the best ways that we can protect those persons is for those who can get vaccinated, which is the overwhelming majority. They should actually get vaccinated. I think we just don't understand what it means to participate in a public health crisis and what our responsibility as citizens are to our fellow citizens. So there was actually an article that was on the news, actually, I believe today, where a young woman who was sick and had actually become vaccinated. And she's one of the rare breakthrough cases, a very uncommon breakthrough cases. And actually one of her main complaints is that she was inundated with people around her that actually were infected because they actually were asymptomatic persons and refused to become vaccinated, thereby exposing her. So.
I agree. The goal is for us to get to herd immunity so that we can protect those who cannot be vaccinated, especially our little ones. So right now, those that are under 12 cannot be vaccinated. And I have two little boys that are under 12. And so I am worried for them every time I go out of the house, even when I go to work. So, and now that they're back in school, But there are people who do have true anaphylactic allergies. It's very rare, but a true anaphylactic is really the only true contraindication for getting the COVID vaccine. And I agree, the ingredients are, you can read all the ingredients, you can pronounce them all.
Actually, I'm surprised I didn't trigger one of you two when I was talking about the folks that can't get vaccinated, because that actually is a lead into pediatrics. And we have two individuals here that are actually trained in pediatrics, and obviously excluding the upcoming consideration with the Pfizer vaccine for school-aged children, that's the population that legitimately, with all due respect to anyone with religious exceptions, that legitimately can't get vaccinated. So my question really is meant to get at what can we do to protect our kids? And as a side question, how do you all feel about the notion of kids actually being asked to return to school, all things considered?
So those of us, so just to reiterate, those of us who can get vaccinated, those of us who have children that we love, whether it's your children, nieces, nephews, family members, we should get vaccinated to protect them. My kids are back in school. They were out for what, 15 months, 18 months. It's all rolling together. They are excited to go back to school. We've had one quarantine session already, literally day 2 of school. Was a classmate of my 5th grader who was completely asymptomatic. And then the whole class had to quarantine for 14 days. So that was a little bit rough after the excitement of going back. He's now back in class, has been wearing the mask the entire time. They are taking all the precautions. I think the school systems are doing a great job, at least where my children are in school. I mean, it's going to happen. It's happening in a lot of classrooms and in a lot of schools where there will be someone positive, and then the kids will have to quarantine.
But should we? I want to climb down the rabbit hole, and I want to introduce Dr. Adams into this question as well, because, you know, the stereotype with kids forever is that whether you're talking daycare or the younger ages of school, these places are just incubators for disease, right? And what is happening, or what has happened in the past, I'll be fair and say to a much greater extent previously, the concern was that kids would go and pick up those diseases and then bring them back home to vulnerable parents or grandparents. Have we done enough to lessen that concern?
Well, I don't believe we've done enough to lessen that concern. And I believe that we're making decisions, not strictly for medical reasons, but also political reasons. And there is a great urgency to get things back to, quote, normal, a great urgency to try to get things going so that people can get to work, so that people can get over this syndrome that we're going through around being so confined and what have you. And so sometimes I think these decisions are being driven by that rather than determining some thresholds that are data driven that will determine when we're at this point, this is when we'll go back. And I think that a lot of the information we're getting, Dr. Sterling, the lay people are receiving is confusing. It is contradictory. From one day to the next, or one expert to the next, you'll get something different. Who should take what when? What works then? When should we be back? When should we be in? The consumer responds more to things that are definitive. And even within your governmental agencies now, we see disputes. And they're carrying on their arguments in front of the country instead of resolving some of these things before announcements are made. So that often from one newscast to the next, you get an entirely different set of recommendations about what you should be doing.
Okay, I hear you, but to be fair, you know, public health often gets bastardized, so to speak, by political will. And again, we do live in a democracy where freedom of choice is a big deal. And the people have spoken regarding this being the path that they want to take. To the two that have training in pediatrics, you know, the American Academy of Pediatrics has been very strong on this question. And have you guys, do you agree completely with the position which you stated for the audience, and talk about, again, I'm gonna stay with us until we can have a consensus on letting the people in the audience know that it's really, we're doing the best we can for our kids, or this is a crapshoot and we're throwing things in the air and hoping for the best and holding things off until the kids can get vaccinated. What's your position on this?
My kids are in school. My kids are in school. They are hopefully vaccinated. They're in the trial. So they have gotten 2 doses of, I hope, Moderna. I won't know for sure until the FDA has approved it. So they're in the trial, but they're also in school, which is definitely, it's going well so far. I mean, I trust that that is the safest place for them right now, but also you cannot take your mask off when you're outside on recess. You cannot sit next to anyone and eat. You have to follow the rules. Do not take your mask off at all. You're wearing an N95 mask. You have hand sanitizer on your lunch bag, on your book bag. So I'm sending you with all the precautions that I have and the knowledge that you as a child can get COVID and get sick as well. You can be asymptomatic, but you can get sick. So they're not just out there thinking that this is not going to affect them or cannot affect them.
Dr. Conway, I'm going to twist a little bit what Dr. Smith had to say, because we actually know that no pandemic has ever ended until vaccination strategies have been fully implemented and immunity was either conferred via natural immunity or via immunizations. So how do we rationalize the fact that kids are still in school without that strategy having been brought to fore yet?
That is a good point. I think that the struggle that we're dealing with in the US is how long can we actually leave our kids out and not be educated? Because then there's a tipping point in the other direction where kids are not being socialized. I talked to a friend whose daughter, they live in Vietnam. They do public health. They're both physicians and they do public health in Vietnam. And they're on a complete shutdown. Why? Because they can't get vaccinations because we have them here in the United States and they're expiring and we're even on our 3rd dose and they can't get it. And so we have a kid over there who could be having a very international experience, but she can't learn, the Vietnamese language because she's at home in another country. And then we're dealing with that here. So I think what we're seeing with is an effort on the part of our leaders to try to balance, if you will, some of the other real concerns that we have for our young people, and socialization, learning in a particular environment like school are super important. I don't think it's because we don't believe that the vaccine is important, but it's like, what do we do in the meantime?
Jeff, I want to hit on something you said about a democracy and freedom and individual choice. Because you know that we don't have that, okay? And you know that the way that we have been able to contain many diseases is by mandates. So the notion that people have of somehow you can choose what you want to do about this is so ill-informed. Your children have to have certain vaccinations to be in school at all, and it is not up for debate. And all of these people who are debating this issue have been subjected to that themselves, and their children have as well. And that's why I say they've enabled this issue to get politicized in a way that is reflective of everything except how to get rid of this disease. Even the guy that a lot of them supported politically, who ought to be claiming as a feather in his cap that he helped get the vaccines developed quickly, many of his supporters are anti-vax. So when they get to be so anti-vax, when they've had every vaccination known to man, most of them would be dead if they were real anti-vax.
And thank you so much, Dr. Adams, for picking up what I'm putting down. You saw where I was going with that, so thank you as always. Let's actually pivot a little bit, and thank you for your indulgence with those questions, but we do get so much concerns about the confusion related to why kids are in school. And so thank you for that. I want to move over to have a little bit of a conversation about variants and boosters and whether this is a hand in glove consideration or whether this is an independent consideration. So let's just briefly put it out there. As viruses continue to exist in the population. They will try to survive by adapting, and that will reflect in variants being created. Again, harking back to influenza, that's why you get different vaccines every year to address what strains may be popping up for a given season. This particular virus appears to have some of the same type of behavior, but the importance of that, to the audience, you don't need to know the Greek alphabet in order to keep track or keep score with what's happening. What you really need to know is that the virus is trying to stay alive for the purpose of not only its survival, but your destruction. And the longer it stays in the community, the longer it will be able to do that. So questions about the variants is much less important as questions about, does that mean that we will continue to see this disease 100 years into the future as we have influenza? And will these booster recommendations address these upcoming variants, or have we crossed the threshold to where we're just going to have to hope that a variant doesn't tilt things to where we go back to square zero? That's an incredibly loaded question, so I'm going to start with our resident scientist, Dr. Smith. Take a swing at that one, if you would.
So the question was, so yes, there are many different variants. Some of them don't cause any problems at all. And some, like the Delta variant, have been the most infectious that we've seen. Will there continue to be more? Yes. Will there be more that are more concerning or infectious than the Delta variant? Possibly. But I agree, exactly like you said, as we continue to not be fully vaccinated, the virus will continue to mutate, and it will get another name, mu, lambda, it'll keep going. There are many, some of them we just haven't heard of because those haven't been as infectious. Currently, right now, the variants that we have, the vaccine is still effective against it. This COVID vaccine has been the most effective vaccine that we have. Now, what will that mean for this time next year, 2022? I'm not sure. Will the vaccine look different, similar to the influenza, where we're going to have to try to guesstimate which variants will be more highly infectious? That I think remains to be seen.
So regarding boosters, let's clarify the purpose of the boosters, because there's two considerations and confusion and trains of thought. Can you just speak to the extent to which the boosters are meant to return antibody levels back to a baseline where they will continue to be effective, versus the notion that the real purpose of the boosters is to provide long-term immunity in a way that the original dosing strategy did not? That's a distinction with an important difference. Do any of you want to comment on that? Okay, well, I will.
Okay, go right ahead.
Well, I mean, again, let me clarify the question, okay, and you can jump in at whatever point in time you want to. There is quite a bit of consternation amongst the scientific community that the initial dosing strategy was more geared toward providing immediate boost of effectiveness up in the 94 to 95% range, but it wasn't the ideal dosing strategy to produce longer term immunity. The goal with this is to have long-term effective immunity. So a 3-month interval between the first and second doses of the Pfizer and Moderna was actually never thought to be an ideal dosing regimen. There are a lot of scientists that have said it should have always been a first dose at 1 month and a second dose at 8 months. And these recent recommendations are split. The reason why we're doing people who are at higher risk sooner rather than later is because they actually do require that boost back up to an effective baseline. However, for everyone else, the reason why you're being asked to wait until 8 months after your last dose is that the goal here is not to make up for the fact that the vaccine is waning, is actually still quite effective, as Dr. Smith said. In fact, it is actually meant to produce a longer term immunity, something that sustains us through this upcoming flu season. Because what we don't want to have happen is a waning of the effectiveness of the vaccine during the winter season, when the when the viruses typically rear their ugly heads up again and become more infectious because we're congregating inside. Does anyone want to add to that or take issue with how I categorize that?
Well, I think I appreciate the elucidation there, But I think that the average citizen is so non-scientific that we've got to think of a way that we can break this down so they understand it. And we give them some levels of comparison so they know they've already been doing certain things. So the idea of a booster is also an idea that's not new. It's just that this seems to be coming rather quickly on the heels of the original dosages. So for us non-medical lay types, we're saying, hey, well, what happened? Instead of realizing that we still learn. Every single time we're learning about this. And as the virus is mutating, we're adapting our knowledge. We're looking at the science as it develops almost. And people are getting a closer look at how the sausage is made this time than they did in past vaccinations. Back in the day, see, I came up during the polio era. And when people were getting those shots and all that, and you were just glad you could get something. You didn't know what it was. You didn't know why. You didn't know what was in it. You just knew you didn't want to be in the iron lung. And if that was going to keep you from being in the iron lung, you were going to line up for it. And you saw people, you didn't hear a single person say, we don't want that.
So to you, Dr. Adams, and to the other non-physicians in the audience, let's just put it this way in the layest terms I can come up with. This was the exact wrong time to not have the maximal amount of antibody load effectiveness against these vaccines, because the summer was supposed to be the low point, just as it was a year ago, right? This is supposed to be the low point because we expect there to be an exponential shoot off when the weather turns cold and people start congregating inside. So the need to get this tapped down as best as we possibly could is exactly right now, because with the Delta variant's boost that occurred, and that new wave that happened, if we had allowed that to be the jump off point for what's going to happen in the fall, we really may have been all the way back to square one. So that in and of itself is a reason why the push for the booster was so critically important. And hopefully that's something that people can wrap their heads around. And the last question I want to ask you guys before we get into some of the more sociology type questions is, all that being said, how do you guys feel? What's the current outlook of COVID-19 heading into the fall and the upcoming flu and respiratory season, both as a result of the virus and its propensity to mutate, and the nation's state of either readiness or unreadiness, depending on where you think we are? Let's have each of you address that. How are you feeling about what's going to be happening for the rest of the year heading into the new year?
For me, I feel concerned. I feel worried. I feel troubled. I try to be non-judgmental, especially with people I don't know so well. With family, I'm a little different, a little bit harder on them. But when I look at the fact that over 4.7, I believe, million people have died worldwide, there has been nothing like this pandemic, except for going back, as you indicated, to the Spanish flu. When we look at the amount of vaccinations that have been done, about 56% of the world has been vaccinated, but 56% in the US have been vaccinated. But when I look at Illinois, we're even less than, the average for the US, or the numbers for the US. I'm concerned, Dr. Sterling, and I want us to get to herd immunity quickly. I'm hoping that the Delta virus, because there's a lot of people that in the scientific community that are believing that the Delta virus is infectious enough to produce enough natural immunity amongst those that that manage to survive, because it's killing off a number of people too, that we just might get there faster, but in a more deadly manner than we had hoped. And to that point, I want to also share one thing. I'm extraordinarily proud of people like Dr. Smith for even having the courage and truly believing, putting our money where our mouth is. She believes in the vaccine. She believes in the science. She's concerned about her kids enough to enroll them in a study. That's another thing. I'm praying that we as Black people, especially, can get beyond some of the more irrational fears that we have, and then begin to ask questions so that we can get true answers rather than just following the pop culture and the pop media and landing at these atrocious decisions where we are. I'm concerned. I'm concerned that we'll lose a lot of people on the way to herd immunity. I'm concerned that we may develop more variants. And then, as you said, the tipping point would be that we don't get a chance to get out of this at all. I don't want to live like this for 2, 3, 4, or more years. It's a tough way to live. And it would be so much easier if we would just all get vaccinated. Because as you mentioned, Dr. Sterling, there's never in the history of any infectious disease been herd immunity without that booster. And I mean the booster meaning that kick coming from a vaccine. We have to have both. You know, and when I look back, I think we all can remember, or at least we know our grandparents who have that big giant mark on their arms from smallpox. It was such a horrendous mark that I remember asking my grandfather, what is that? And it was smallpox. And nobody complained about it, as Dr. Adams says. But guess what? There's not a smallpox vaccine on any of our, our CDC list. Why? Because it's gone.
That's right.
And I'm just praying that we can just come together, especially as a community, even if we can get a certain protection bubble around the people that we are around in our counties, in our states. You know, it may not get herd immunity nationally, but what about trying to make a smaller goal in our communities? But I'm afraid that we may not get there, and that's disturbing because I don't want to live like this. I really don't.
Dr. Adams, you want to follow up on that?
Well, you know, I'm at the point now where if I go to the grocery store, I feel like I'm on a major outing. You know, I turn up the music, I roll down the windows, I let out the sunroof. It's like, hey, party over here. So I'm with you, Dr. Sweetie. I don't want to live like this. And I think that one of our challenges, Dr. Sterling, is to come up with some additional ways to convince. Okay, we have to be able to respond in a way that our folks don't feel attacked, feel loved, and that we love them enough to really keep at this, because we have got to improve our stats when it comes to getting vaccinations. I've been working a number of events. This past Saturday, I worked an event where we were trying to get people vaccinated in the community. And I spoke to a young woman who was engaged in registering people to get the vaccinations. And something just told me to ask her, had she been vaccinated? And she had not. And I said, so you're out here trying to tell some people to do something you didn't do. I said, tell me this, why haven't you? She absolutely could not give me any reason except she heard it might not be good. But to really delve into the risk that she was taking, how it was going to impact people around her, what she could possibly do to the people in her home and all that, she hadn't even thought about it. So we think because we're talking about these details all the time, that they're really reaching folks. When we got a lot of folks that aren't watching these reports on CNN, they don't know what the CDC said, they don't know this or that, but they heard something, some gossip, or some other kind of piece of information that's taking them down this rabbit hole. So it's incumbent upon us to engage not just our medical community, but our marketing community, our entertainment community, our athletes. I was happy to see a new initiative they have out of the NBA of guys coming forth telling people to get vaccinated. We have got to get this message at every single level. And we really have to promote the idea of mandates because it's the only thing that's going to make some people do it. And now we're looking at people losing their, I just read that 600 people are going to not work at United Airlines because they don't want to get vaccinated. So, you know, I'm hoping 600 people that we know that are unemployed can get those jobs, but I'm wondering how long are people feeling they're going to sustain themselves and what their point of view is about public and what public health is really all about.
Thank you. Dr. Smith, how are you feeling about going into the fall?
So I'm a little concerned as well. It's already starting with just cough, sniffles, flu, or cough, sniffles, and kids are already having to leave school to go get tested to prove that it's not COVID for them to go back in. I had one friend that said that her daughter asked the school nurse, can she have a cough drop, and was sent home to go get a test. So I think with just the usual colds, we're going to be scared about even the usual colds. So that those are already happening. So we're not going to be able to tell apart a regular cold from the influenza, from COVID vaccine. So we're going to be worried about all of this, on top of people feeling a little bit more free, especially if they are vaccinated, that they can, you know, travel, go to a lot more events. I have not changed a lot just about my day-to-day activities. Because again, I don't want to have a breakthrough case. I don't want to bring COVID home to my children. And I really don't have time to be quarantined from work for 2 weeks. You know, it is important, I agree, to continue to educate. It starts with our own family members and friends. I have done just quite a few COVID talks. I was saying when I was updating my slides, the last talk I had given was probably about 6 months ago. And it was like 2.5 million children had been diagnosed with COVID. And then I gave a talk just last week, and it was like 5.5 million.
Wow.
Already 5.7 million just today. So the numbers change so quickly. And so I just worry that people are still thinking that it's not going to be them, or it's not going to be their child. But we've had so many people lose parents, lose children. And so, you know, I hope that, you know, and then the thought was, I didn't think it would be this bad. I didn't think it would affect me, or if I got it, I didn't think I would be this sick. I mean, the people who do survive, who've had to get lung transplants, who have, you know, symptoms of long COVID. I mean, it's just so frightening. We don't even know what symptoms you'll have, even if you're asymptomatic initially with COVID.
So do you think that means we should tell more of the horror stories?
You know,
No,
oh, I'm sorry.
go ahead.
I was going to say, I'm reminded of the scripture where Lazarus asked, could he go back and warn his brothers about hell? And Jesus said, they didn't listen to me when I was there. They didn't listen, and they wouldn't listen to you if you went back. And that's the thing that stands out to me, is they've heard the horror stories and how they compartmentalize it elsewhere. They hear the horror stories. I've heard
They
doctors
even get COVID.
Okay, guys.
Yeah.
Hold on.
Mhm.
All of what you're saying is obviously the case, but let me throw a little sunshine onto our rainstorm. Just today, there was actually a release of data from the Kaiser Family Foundation. Many of you're all familiar with KFF. And in terms of health inequities and healthcare disparities, the numbers are changing. A survey has now found that the gap is pretty much closed. We're up to the point now to where 73% of Hispanic adults, 71% of white adults, and 70% of Black adults in the US have now received one dose of a COVID-19 vaccine. Over the last 2 to 4 weeks, actually, the numbers have pretty dramatically changed. Efforts to inform people, to give people accurate information, to move away from the whack-a-mole of addressing myths and dealing with things that are relatively comparatively unimportant to getting people actual facts and letting them make accurate decisions is starting to pay off. And the idea of trusted messengers and voices like ours actually being involved in research from very early in the process, that's one of the stories that's been untold about COVID-19, not to the extent to which it should have been. We have been overrepresented relative to anything in scientific research with respect to COVID-19. There have been prominent Blacks involved in the development and the research of this vaccine. There have been prominent Blacks who have been part of the administrative panels, the governmental panels that have set policy for how this has played out. And even now, there are prominent voices all across the country that are fighting hand-to-hand combat, out there doing what's necessary. You know, Dr. Adams and I, obviously with Simcoe, we're part of a trusted messenger initiative that has now vaccinated folks in Atlanta and DC and Chicago and Houston. We're heading to New Orleans. And these types of efforts actually pay off. So the more information you give people, believe it or not, people are actually responsive. And there's a reason why the initiatives back in the 70s led to all of us getting accepted to medical school, because we're the individuals that ultimately need to be on the wall. And to the people that are asking questions about all the myths, look, you have to believe that we would literally be the first individuals telling you if this was another Tuskegee, if this was something that was harmful. But the fact of the matter is that we are here putting up the go sign because it's actually okay. And I was so upset that we weren't fighting our way to the front of the line in the way that other groups such as teachers were, when we in fact were the recipients of so much more disproportionate death and disability due to this disease. So we're going to continue that fight. But again, I'm not going to end there. We have just a couple more minutes, and I do want to get in some of the questions that are being asked. But Dr. Adams, there's so much that we could have been talking about in terms of community-based sociological efforts. And I do want you just to opine about what we've been doing and what we can do better and what are best practices to effectively get at members of our community to let them know that this is not based on opinion. This is not based on your feelings. There's not an equivalent conversation between your opinions and medical, scientific, and public health facts and best practices. So where are we relative to what we could and should be doing?
Well, I think what we're doing right now is taking this right to the neighborhood and being able to get people right at the spur of the moment. They don't have to have signed up weeks ahead anymore. There are lots of places you can get it. There's encouragement. We're bringing bells and whistles out. When we try to attract people, we're getting in parking lots with DJs, and we're doing pop-ups, and we're even coming to your home so that if you can't get out, we'll come to you. And I think those things are helping. I think, unfortunately, the other spur is that more and more people know somebody who got it. And then it encourages them to go and do something because they don't want to see it happen to them. We see situations where people have been to a family reunion or something and everybody got infected. So that's making people get more willing to do this. The whole notion that people had at the beginning of coming up with the vaccination too fast and not knowing how it's going to turn out. Well, now you know how it's going to turn out. You know that this pandemic now is a pandemic of the unvaccinated, and that people who have been vaccinated are not in the main getting COVID. And if they do, it's mild and they're moving right ahead. They're in some cases telling them don't even come in the hospital. So we're getting it right. We have to keep at it, keep at it, keep at it. I think some of the mandates that are coming now are going to make people get it because they're not going to want to be barred from everything. So places that are requiring that you have a vaccination or a negative test to participate, those things are going to spur some additional folks as well, Dr. Sterling, and I think that will help us out a lot.
You said a whole word there, and that's going to be, we have to reaffirm that. This is not political, folks, but it's becoming politicized in the following way. This is a pandemic now of the unvaccinated. And there is plenty of data, fresh data. I read some more data that came out today that the so-called red states are really where this is now happening. And there's a clear correlation between vaccination rates and survivability from this thing. So again, you can continue to be obstinate and address any conspiracy you want to, but the truth of the matter is that that number that's now approaching 700,000 deaths is a real number. You can have your reasonable concerns, but you can't have your unreasonable facts. So we're happy to address your legitimate concerns, but not your irrational fears. So this time and this space is going to be used to address informing you of where we are, what we should be doing, and where we're going. Just not going to do the whack-a-mole thing, talking about a lot of myths and unfounded concerns, folks. You can get that plenty of other places. You can never disprove a negative, and there's so many myths about chips being, no, we're not going to do that here. So what I want to do with the limited amount of time that we have before I turn it back over to the Urban League is to basically give each of these fantastic panelists an opportunity just to communicate whatever message you want. And I'll ask you to do it in a minute or less. Just tell the folks what you want them to know so that we can survive this thing and keep it moving. I'll start with you, Dr. Adams.
Well, I wanted to tell people to pull the folks that are close to them even closer and to come up with a way to talk to them about it that is not oriented toward belittling or attacking people, because all that it does is make folks dig in further and get very obstinate about this. We have to tell them that because we care about them, this is what they need to do. And then we have to make our behaviors suit theirs. In other words, I stopped going to certain people that I was going to for certain services in my life if they were not vaccinated. And I didn't mind asking them. I didn't think there was anything wrong. People say, that's personal. No, what's personal is if you make me sick. And I'm not going to allow that. So I ask people, who I'm going to say, are you vaccinated? And if they're not, I let them know I'm going to have to make another choice. And if you want to discuss this, I'd love to discuss it with you because I want you to be safe too. The other thing, just quickly, that I'm concerned about as a sociologist, and I'm not going to belabor it, is the behaviors that are going on that you see in public places around this issue. Fighting and arguing and getting put off of planes and this and that. It has gotten to a point of sickness, really, mental and emotional despair that's making people even fight about this. They're so concerned about the individual freedom that they have never had. And so we just have to keep on at this and start near us and spread it far and wide.
Thank you very much. Let's go to Dr. Smith.
I would just ask everyone to please get vaccinated. And if you have any questions or any concerns, please reach out to someone that is in the medical field that you trust that can answer your questions. If you feel uncomfortable asking in a large group or on your family Zoom, ask one-on-one. Here are my concerns. A lot of times those questions will result in someone choosing to get vaccinated or at least relieving those fears. Even before COVID, I remember having tons of these conversations with my friends when they were going for their first vaccine appointments for their infants at 2 months. They were like, I know they need it, but I'm scared, I'm nervous. And we just had a conversation about it. And they were like, okay, I feel so much better. So please have those conversations so that you get vaccinated. Please keep yourself safe, your children, your family members, and your elders.
Thank you. Dr. Conway.
I just want to communicate that the vaccines work. They work. When I look at the prisons, we have close to 70% of our incarcerated men and women that are vaccinated. As of this day, today, we have 0 offenders that are incarcerated men and women that are positive, but who are positive are staff persons, many in the healthcare field who refuse to get vaccinated. These are our ambassadors. It's very unfortunate. I do agree with you, Dr. Sterling, that, reaching out to our community has made a difference. I know of many people who've told me that they got vaccinated because of the things that I shared on my Facebook, and I'm sure you as well. So we'll keep trudging through, but I want you guys to know that the vaccines work. And in regards to the mRNA technology, it is not a new technology. I want to say that too. That is one of the things that we're incorrect about. mRNA technology and the study of this particular technology has been around for over 20 years. Perhaps the inventor will get a Nobel Peace Prize for her fantastic, amazing work. It has been used in biologics for autoimmune types of disorders and studied for that. And when the SARS-CoV-2 pandemic unveiled itself, that was like the second go round at, troweling using this mRNA vaccine. So, or beginning to think about using this technology. And then it was like showtime. So I want to say that it works. I am proud of one thing that our government has not been afraid to, basically ego. They haven't allowed ego. You kind of shared this, when you talked about the COVID booster and how people would feel about a COVID booster being required. Whatever it takes to keep us alive is what we should be focusing on. Whatever it takes to keep us healthy. I received my booster because I'm 8 months out. That's my 3rd shot. No second head, no additional arms. Doing just fine. And I would encourage everyone, I think we are preaching to the choir here, but continue to share the message in your small group and try to win people over, as Dr. Sterling says, with the facts.
I want to thank you all, and I'll keep my comments short. one of the rules of emergency medicine is that you don't let a potential side effect get in the way of you taking care of a life threat. This is a pandemic, folks. Almost 700,000 people in the United States have died. We're sitting here majoring in minor stuff, talking about side effects. No, over half of the world has now been given a dose of this vaccine. This is not new. This is not unstudied. Stop it. If you have questions, I promise you, I'd spend all day, every day talking to people about this vaccine. It gets on my nerves, but that is what we're here for. We will get you actual facts. Your opinions or your feelings are not the same as medical facts. Allow us to show you. We actually have references and sources that we can provide you that aren't Facebook memes or video conspiracy theorists. People want to talk about, well, I know a doctor that doesn't feel this way, but 96% of physicians have been vaccinated. There is clear consensus in the medical, scientific, and public health communities. We care deeply about our community. We are here to help. None of us are tools of this is just so crazy. Our lives are because, I am because you are, we are, right? And this is our responsibility. We take it seriously, and we want to do whatever's necessary to get us over this, because it is our community that is disproportionately being affected by this. And until we allow ourselves to be educated and to become better stewards of our own health, we're going to keep getting what we've been getting. So with that, once again, I certainly thank the Chicago Urban League for offering this platform for us to share this information, address your concerns, and hopefully provide you some insight into what we've done well. This is not over. It can get worse. You still have things to do. Grab your family members, hold them close, convince somebody that you actually care about to get vaccinated. It matters. So thank you very much. And with that, I'll turn it back over to the Urban League.
Thank you so much, Dr. Sterling, Smith, Conway, and Adams for just such an insightful conversation, addressing many of the things that I know I had on my mind just from the conversations that I've been hearing in our parking lot at the Urban League as we've been trying to get people vaccinated. And I was really encouraged to hear some of the new statistics that you shared, Dr. Sterling, today. They were out today. So that actually cheered my soul, because I've been really concerned, I'll just say quite frankly, about our people, because our numbers had not been looking so good. So I appreciate that. I know we had a number of comments. I think through the conversation, you guys addressed many of them. Dr. Sterling, you also referenced, sort of giving people good resources to go to. If we could just close with one thing, could you share, like, for someone who still just has questions or don't know where to go to get information about to counter some of the myths that are out there, what are some good sources that people can turn to online or elsewhere?
There's one source. Go to cdc.gov. My goodness, they've done such a wonderful job with their website, and it answers any and every question that you could possibly want in a way that is surprisingly reader-friendly. It's not medical jargon and all the rest of that. That is the definitive source. I'll talk to you all day, every day, and I'll give you what I know. But again, if you want medical consensus, start there. Start there. And by the way, thanks to the panel for not bringing up either ivermectin or hydrochloroquine at all during the course of the conversation. But yeah, please go to CDC. And, I actually, at Simcoe, we're huge advocates of empowering people and the whole self-education. But you have to learn. You have to consider the source. You have to know what's good data and what's not good data. So when you look at an article, consider the source. When you hear a conspiracy theory, consider the source. When you're listening to this conversation, consider the sources. And that's half of the battle. You really have to guard yourself against just jumping in the deep end with your fears on this. And I know it's hard sometimes, but we are so far of where this is an unknown entity and the death count is so staggering that, a little bit of trust is going to get us there.
Okay, thank you so much again, Dr. Sterling. I want to thank everyone who joined us either via Zoom or on Facebook. If you tuned in late and got the end of it, the video will be available on our Facebook page. So again, thank you all for participating and attending, and to all a good night.
Good night.
Thank you for having us. Good night, all.